Hi there, my name's Megan and today I'm doing my oral presentation on strength training and the older adult. I've chosen this topic because where I work, a high majority of my clients are from the retired age group. And they have a lot of worries and concerns about getting older and about their decreasing strength, flexibility and balance. So I've chosen this topic to help improve my knowledge so that I can help my clients the best that I can to help them maintain a higher independent quality of life for longer. So one of a well-documented problem with aging is a loss of muscle mass. Now, one of the factors relating to this is a decrease in physical activity by the older adult, which decreases muscle mass in the body. So hence the term use it or lose it. The consequences of this can be quite extensive. It can contribute to a susceptibility of falls and fractures, a slowdown in metabolism, possible deficiencies in glucose regulation, and an overall loss in the ability to perform everyday tasks. Studies have shown that older adults that participate in a regular exercise program can reduce and prevent a number of the functional declines associated with aging. And older adults can make significant gains in strength given an adequate training program. Okay, so the health benefits of a strength training program for the older adult is numerous. They will include noticeable improvements in strength and muscular endurance, which creates improvements in functional capacity. And this will help to improve balance and coordination greatly. In addition to this, weight-bearing exercise has proven to be beneficial in increasing bone density and aiding the effects of osteoporosis. Strength training also has a positive effect on insulin action within the body. Most importantly, before any client of the older age begins a strength training program, they should undergo a health history and examination. This will help to identify any of the risk factors associated with them starting the program, and in some cases clearance may be required from a doctor or from another specialist. Okay, then you can move on to working out the strength training program for the individual. The FIT principle, frequency, intensity, time and type, is extremely helpful. So frequency refers to the number of exercise sessions per week. So current guidelines now are around 2 to 3 sessions of strength training per week are adequate enough to see gains and progressions in strength. Intensity refers to the amount of weight being lifted. Guidelines suggest that a completion of one set of 10 to 15 repetitions is adequate. This would give a weight factor of between 60 and 70% of 1 rep max. Time refers to the length of each training session. Each session should aim to be around 30 minutes in duration. However, breaking the session into parts, so if they were to do 3 10-minute sessions, would be just as beneficial to the older adult. Type refers to the type of exercises being performed. Compound exercises are favourable with the older adult, especially exercises that will replicate functional movements that they need day to day. Machines are often preferred over free weights. However, as a client progresses, moving on to free weights would also give them an increase in balance and stability and coordination, which would be extremely helpful for them. But the use of free weight, the use of machines initially will ensure a safe exercise environment for the client. 1 to 2 exercises per muscle group is adequate, with around 8 to 10 exercises in total for the new client of the older age group. So an older client without any reasonable base of fitness would have a program with just basic exercises for legs, back, chest, shoulders, arms and core work. That would be enough to see them to getting to that initial base strength so that you could progress them further from there. It's important to remember that that all exercise programs should be safely delivered, carefully monitored, and slowly progressed to continue to improve client strength and functional movement. Muscle groups should always be safely stretched at the end of the exercise to help improve flexibility where applicable. By way of progression, it can be done in many ways. It could be a slight increase in weight, the addition of another set to their training program, or like we spoke about before, moving the exercises to free weights to help improve the balance and stability of the client. Finally, just in summary, it's important to remember that a regular exercise program and physical activity for the older adult can help improve strength, functional capacity, and increase in energy levels, and that therefore will greatly improve their quality of life and independence. Excellent. Thank you for listening. Bye.